I'm curious about your journey and how you've implemented these programs and your own personal journey. What have you seen as some of the biggest obstacles that are preventing Lutheran congregations from maybe embracing mental health ministries?
Mhm. Well, I think still the number one roadblock is stigma surrounding mental illness. And we've been working hard at trying to chip away at that within our local congregations, but it takes time, right? It takes the opportunity to have these educational experiences brought into your congregation to help people to understand that mental illness is just like a physical illness. If someone has diabetes or cancer, they're often very quick to let the pastor know about it or request prayers for it from other congregation members, but often reluctant when it comes to being diagnosed with a mental illness such as clinical depression or bipolar disorder or schizophrenia or something of that nature. And we just want people to understand it's a biological, medical condition. So stigma, I think, was the number one roadblock. But something else that we already had mentioned is just the manpower to kind of get it up and running and off the ground. That, pastors are often overloaded with numerous other tasks that they need to take care of. And so part of this mental health advocate initiative is really to help have a point person in the congregation to help walk alongside the pastor and support him in rolling out some of these mental health initiatives so that he doesn't feel like the burden's all on his shoulders. Another thing too, we realized that many congregations didn't have access to especially faith-based resources on mental health. And so that's one reason why we created the Look Up Indiana faith-based resources, including the mental health toolkit, to kind of meet that need and fill that gap, so to speak.